Welcome back to Western New York Living. If I mention the words uterine fibroid, many of you may not be familiar with what I'm talking about. But if you're a woman who suffers from this issue, you are well too familiar with those two words. Joining us this morning to better explain uterine fibroids is Dr. Zirk Iqbal from the Buffalo Vascular Care Center. Doctor, thank you very much for being here this morning. First off, can you explain to us what exactly are uterine fibroids?
Good morning, and thank you for having me. Uterine fibroids are benign tumors that occur in the uterus. These are there because of a genetic predisposition. 1 in 3 women have it, more common in African American women and in Asian women. These tumors grow with time, with hormonal changes, etc., and they produce their symptoms by the virtue of their location and their size. The symptoms could be anything from pain and cramping in the pelvis to heavy bleeding during menses, or bleeding in between menses, or pressure on the urinary bladder, etc.
Doctor, a lot has changed in 15 years in the treatment of fibroid tumors. Explain to us the difference between how they used to be treated as opposed to how they're being treated today.
Initially, after failure of hormonal and medical treatment, they were treated usually by removal of the entire uterus with the fibroids to relieve the patients of their symptoms. However, over time, as minimally invasive approaches have gained more acceptance and we have done more studies, we have found a way to actually starve these fibroids of their supply of oxygen and nutrients, and to shrink them without having to remove the entire uterus. And this procedure is called uterine fibroid or uterine artery embolization.
Well, why is this a better procedure, doctor, in your opinion?
When you compare the two approaches, this surgical approach takes out the entire uterus. So it involves hospitalization. It's a major surgical procedure, incision, anesthesia, and about 6 to 8 weeks recovery.
Wow.
On the other hand, uterine fibroid embolization procedure is a uterine sparing procedure. So it does not remove any of the parts from a woman's body. It's done as an outpatient procedure through a small puncture or a small access site in the artery in the wrist or the groin. And the patient goes home the same day. The recovery is only a few days, and most women can return to work after a few days.
Wow. Who's a good candidate for this procedure, doctor?
Almost all women above age of 35 who are not actively seeking to get pregnant could be a good candidate. We usually get an MRI first, and based on history and the findings on the MRI, we determine if the patient is a candidate or not.
Beautiful. Doctor, thank you so much for joining us this morning. Buffalo Vascular Care has over 20 years of experience in helping patients with a variety of vascular problems in Western New York. They offer safe, non-surgical solution for treating uterine fibroids in the comfort of their centrally located outpatient facility. If you'd like to find out more, you can head to their website at buffalofibroidfree.com, or you can give their staff a call at 852-1977. Well, that's a wrap for our show this morning. We want to thank you so much for being here this Saturday. Remember, you can catch Western New York Living every Saturday morning, 9:30. We'll bring you an entirely new show filled with wonderful guests. And I hope you could all enjoy the rest of your weekend and stay safe. We'll see you later. Bye for now.